80% to 90% of the spine problems come to what we did in each day. Like if you always like sitting wrong, standing wrong, do wrong activities.
Just one example of sitting wrong and sitting right.
Very, very simple way is your back should be straight. So if you sit with your back straight, that's right. Most common question also, which is the best pillows? The same concept. Any pillows that you sleep onto it, your neck straight. It's good for you.
We got some free consultation there.
If you compare us to other private facilities, I would say we are about 20 to 30% lower with better value. Doctor was explaining, we are known as King of Bone. So basically we use the best implants, the best technologies, whatever. But the price, it's affordable. It's very much affordable.
The success rates of surgery, 90% above, if the patient is fit.
And I've been working 15 years. And I have patients from Bangladesh for the past 13 years as we started the market. I haven't had anybody really complain about that it's too costly or something.
দুইটা বিষয় আমাকে খুব অবাক করে। যে পরিমাণ মানুষ আমার পডকাস্ট দেখে এটা অসম্ভব উৎসাহজনক, কিন্তু যারা আমার পডকাস্ট দেখছেন তার 80% আমার চ্যানেলের সাবস্ক্রাইবার না। একটা অনুরোধ করছি, আপনারা যদি আমার চ্যানেলে সাবস্ক্রাইব করেন তাহলে আমার কন্টেন্টের কোয়ালিটি, টপিক সব কিছু যেমন একদিকে অনেক বেশি আরও ইমপ্রুভ করবে, আবার আপনারা নিশ্চিত থাকতে পারেন আমার কোনো ভিডিও বা পডকাস্ট আপনারা মিস করবেন না। সো প্লিজ সাবস্ক্রাইব। আজকের পডকাস্টটা খুবই ইন্টারেস্টিং, কারণ আজকে আমি ভেজথানি হসপিটাল, যেটা থাইল্যান্ডের সবচেয়ে রিনাউন্ড হসপিটালের একটি, তার ওয়ান অফ দ্য বেস্ট স্পাইন সার্জনকে আমাদের পডকাস্টে পাচ্ছি এবং তার পুরো টিম আজকে আমার সাথে জয়েন করছে টু এক্সপ্লেইন তারা কিভাবে এত চমৎকার একটা হেলথ কেয়ার ইকোসিস্টেমকে তৈরি করলো। এছাড়াও 5 আগস্ট পরবর্তী সময়ে যেই বাংলাদেশের বাইরে যেই হসপিটালে খুব স্পেশাল কিছু ক্রিটিক্যাল কেসকে রেফার করা হয়েছিল, সেটাও ছিল এক্স্যাক্টলি এই থাইল্যান্ডের ভেজথানি হসপিটাল। সো লেটস ওয়াচ।
আজকে আমাদের সাথে খুবই ইন্টারেস্টিং একটা এপিসোড নিয়ে আমরা এসেছি, যেখানে আমরা জানার চেষ্টা করব থাইল্যান্ড এবং থাইল্যান্ডের একটা হসপিটাল, প্রিসাইসলি ভেজথানি, তারা কিভাবে হেলথ কেয়ারকে এত আমাদের বাংলাদেশিদের কাছে এত পছন্দনীয়, জনপ্রিয় করে তুললো। উই হ্যাভ এক্সাইটিং গেস্ট, প্রফেসর ডক্টর পাত্তারা। Thank you, sir, for joining. A very special spine surgeon working in Thailand Vejthani Hospital. We have Miss Masha, who is also involved as the international marketing manager of the hospital. We have Mohammed Nur Hossain bhai, international patient advocate, and Muhit Ali bhai, so country consultant for Bangladesh. Thank you, everyone, for joining.
Thank you for having
Thank
us.
you.
Is this your first time in Bangladesh?
Yeah, actually it's the first 2 days in Bangladesh.
So approximately, in your understanding, is it very frequent that Bangladeshi clients visit you in Thailand?
Yeah, we can say like a lot of patients that are traveling to Thailand to get some treatments there.
So what are the most common cases or struggles that they have for which they visit Vejthani, or more precisely visit your center?
Actually, my center is a spine center. Yeah. So most of the patients who come to see me, mostly they have got like some degenerative problems and the disc problems. So normally these two problems is coming from 2 main factors. First is ages, and second is lifestyle, like working, the way they sit, they stand, or like even body weight.
Do you think the these particular problems are increasing significantly year by year?
Yeah, it's increasing like exponentially. Yeah, maybe because of our lifestyle, like right now, the cell phones also, because we found that many people got like neck problems from like you bending forward, playing with your phones all the time. Yeah, so it's causing like from the lifestyle,
low movement, low body movement.
Yes. And another is like we found that the ages people, the elderly, is like many people, they got like longer lifespan, right? So yeah, the degenerative problem come after that.
Miss Masha, one of the things that excites me about Thailand is, considered to many countries in Southeast Asia or larger Asia, Thailand is a small economy, comparatively a small country, but their healthcare is amazing, absolutely amazing. What are the key components that you feel as someone who's working with that healthcare is exciting or significantly better than other service providers in Asia or in Southeast Asia?
Well, for one, Thailand is very well known for service, right? So whether it's hotels or hospitals, it's very much focused on service. So healthcare is also the same as that. So primarily we focus a lot on giving the best service in the sense that the patient always feels connected to the hospital. They don't have any miscommunication or disconnection, like from the very first step that they decide they want to travel to Thailand. So the hospital will be there for them, like to the office to process the visa, to do all the ticket, like everything organization, and to help them. And then to do like a treatment plan and make sure that they get exactly the correct diagnosis as well as the estimate cost, everything. So they're pretty much ready since they're here. And when they go there, we have a service to pick them up from the airport, bring them to the hospital, take care of them. We have a coordinator who will be there like on call 24 hours. And then the other time they will stay with them the whole day to visit the doctors and translate for them and everything. So it's basically like you're always having service given to you. So this is the main thing of healthcare in Thailand, as well as that there's always the aspect of advanced technology. Thailand focuses greatly on purchasing the most advanced equipment and up to date. Not only in our hospital, we always renew everything at Vejthani. So whenever a new MRI or a new machine comes out, we renew it and buy the new one. But also all of healthcare, like in Thailand, they do that because it's important to keep updated, you know, with the newest technologies and everything. And I think the other aspect is that Thailand is very famous in private hospitals, especially in Vejthani Hospital. We send our doctors abroad for trainings and to do all the seminars, trainings. So they go to America, Europe, UK, Australia, whatever country, in order to advance their education. So they're never just stuck in one point where they're just focused on what they know. They're always expanding and learning more. Yeah. And I think this is the main part of healthcare in Thailand.
In terms of the overall healthcare ecosystem in Thailand, so you have, as a professor, you have exposure to not only Thailand, but other countries as well and what is happening. More on the medical education aspect and practice aspect. How did the ecosystem significantly improve considering compared to other countries like many other parts of the world, maybe Pakistan, India, or in Bangladesh, the healthcare ecosystem is very profound, even when I visited there. So what do you think is the X factor or the key difference where Thailand is extremely good? As a healthcare professional, what have you experienced?
I can say like Thailand about the health education, like medical educations, we quite like very active. Like from the government side also, and from like medical schools, they are very, very active. It's not quite like some countries, they're quite conservative. So everything is like based on standard. So it's grows slowly. Some countries is like too aggressive. So everything is just quite like experimental or something. But Thailand is quite in the middle. Yeah, we are active to learning, but based on the standard also. For the government side, they're trying to increasing the amount of the specialists and doctors each year. So medical school, they have some full support from the government to do that. And also about technologies. We found that most of medical schools in Thailand, they can get like the newest technologies into the department and the units. So the learning curves is growing very fast in Thailand. And also we can say like many amount of doctors in each year, they also like get some postgrad education abroad. So we can bring all the new knowledge back to Thailand. And another thing is like in Thailand, I feel like in compare with US or Europe, see like specialists easier. Sometimes in another country, you have to see the GP first, then followed by like some specialist, but not right there into the specialist that you want to see. So in Thailand, you can see the specialist easier. Yeah, so it's feel more comfortable for most of the patients, like because sometimes you know like okay, you got the spine problems, you want to going right there to the spine specialist, not like general orthopedics first, GP first, then refer you to the spine. Yeah.
Sometimes even in the Western countries, after visiting the GP, if someone needs consultant, they have to wait for 3 to 6 months or even more. And compared to that, in Vejthani hospital, they can immediately shift it to a consultant or a specialist. Or if they need a surgery, that can be fast moved and processed.
Right. It's like, for example, today you see at the counter service, and after half an hour you see the specialist, and then next day or few days you can have an operation if you need.
So Muhit Ali bhai, আপনি যদি একটু বলেন যে বাংলাদেশিরা ভেজথানি হসপিটালে যাচ্ছে বা এখন চুজ করতেছে, আপনারা অনেক বাংলাদেশি পেশেন্টদেরকে নিয়ে আপনারা ডিল করেন, তাদের ওভারঅল ফিডব্যাক কেমন যখন তারা সার্ভিসটা নিয়ে তারা ফেরত আসতেছে?
সার্ভিসটা ওভারঅল তাদের যখন মানে ফার্স্টে যাওয়ার আগে একটু হেজিটেট থাকে, চিন্তা থাকে যে একটা নতুন দেশে যাব, ট্রিটমেন্ট নিব, কোথায় থাকতেছি, মানে বাংলা খাওয়া কোথায় পাবো, কতদিন আসলে থাকা লাগবে, কিরকম টাকা লাগতে পারে, এগুলি নিয়ে একটু চিন্তিত থাকে আর কি ফার্স্ট অফ অল। সো ওইগুলি আমরা যখন আমাদের কাছে আসে, কন্ট্যাক্ট করে, আমরা এগুলি সবগুলি টেক কেয়ার করি ওয়ান বাই ওয়ান, স্টেপ বাই স্টেপ। যখন যেরকম লাগে ওরা whenever they need they call us, এগুলিতে আমরা ফুল সাপোর্ট দিই। আর একটা ফ্যামিলি বন্ডিং এর মতো হয়ে যায় তাদের সাথে আসলে। সো তাদের যখনই লাগে তারা আমাদের সাথে যোগাযোগ করে। আমরা স্টেপ বাই স্টেপ ফার্স্টে ভিসা প্রসেস থেকে শুরু করে সবকিছুই আর কি করি, ভিসা প্রসেস হয়। ইন দ্য মিন টাইম আমরা তাদের মেডিকেল আগের থেকে রিপোর্ট থাকলে এগুলি নিয়ে আমরা আমাদের টিমের কাছে দিই হসপিটালে তারা একটা বোর্ড মিটিং করে যদি কোনো মাল্টিডিসিপ্লিনারি ট্রিটমেন্ট প্রয়োজন হয় তাদের। সো এইটা করার পরে তারা আপনার একটা ট্রিটমেন্ট প্ল্যান দেয়, ওইভাবে ডক্টররা সেট করে যদি মাল্টিডিসিপ্লিনারি লাগে। তো ট্রিটমেন্ট প্ল্যান অনুযায়ী একটা অ্যাপ্রক্সিমেট কস্ট প্লাস কতদিন থাকা লাগবে ওটা রিটার্ন ভাবে আমরা দিয়ে দিই। দেন ওইটা অনুযায়ী পেশেন্টরা যায়। আর মোস্ট ইম্পর্টেন্টলি ডক্টর সিলেকশনটা আমরা করে দিই এখান থেকে, প্লাস হসপিটাল থেকে, ম্যানেজমেন্ট থেকে। সো যাওয়ার পরে ট্রিটমেন্ট নেওয়ার পরে আর মোস্টলি দেখা যায় যে ট্রিটমেন্ট নিয়ে যখন আবার ফেরত আসে তারা, তারপরেও আমরা আবার ডক্টরের সাথে কানেক্টেড থাকি ফলো আপের জন্য। তারা আবার যখন যায় ডক্টরের সাথে কন্ট্যাক্ট করতে পারে। সেইগুলি নিয়ে তারা দে ফিল লাইক যে মানে থাইল্যান্ডে যে ট্রিটমেন্ট নিয়েও তারা মানে বাসায় বসে থাকা বা বাংলাদেশে থাকার মতোই তারা ফিলটা করে, যে তারা কোথাও যে ডিসকানেক্ট ফিল হয় না। ইভেন হসপিটালেও যখন থাকে, হসপিটালে যে কোনো ফ্লোরে বা যে কোনো সেন্টার, আমাদের হসপিটাল ডিফারেন্ট সেন্টারে ট্রিটমেন্টের জন্য যায় বা কাউন্সিলিং করতে থাকে। সো তখনও যদি আমাদেরকে কল দেয়, ইভেন মানে হসপিটালেও আমাদের বাঙালি লোক আছে এবং বাংলাদেশেও আমাদেরকে ফোন দিলে যদি প্রয়োজন হয় আমরা সাথে সাথে ওইটা টেক কেয়ার করি। সো তারা কোথাও আর কি ডিসকানেক্ট থাকে না, তাদের যখন মানে প্রয়োজন তারা আর কি সাপোর্টগুলি পাচ্ছে।
একটা লম্বা সময় তো বাংলাদেশিরা যখন দেশের বাইরে চিন্তা করতো, তারা সাধারণত থাইল্যান্ড চিন্তা করতো না। আমি বলছি 20 বছর আগে। আমরা লাস্ট 5 to 10 ইয়ার্স আমরা কন্টিনিউসলি দেখতেছি যে তারা অনেক বেশি থাইল্যান্ডের ব্যাপারে পজিটিভ। এটার আপনাদের কাছে কি মনে হয় যে এটা বাংলাদেশিদের মধ্যে যে থাইল্যান্ডের সাপোর্ট নেওয়ার যে জনপ্রিয়তাটা বাড়তেছে, এটা আপনাদের কাছে যারা আপনারা কাজ করেন মেডিকেল ট্যুরিজম নিয়ে, আপনাদের কাছে কেন মনে হয়?
আমি যেটা বলবো কেন থাইল্যান্ডকে মানুষ চুজ করে, এটা হচ্ছে মূল কারণ হচ্ছে ভরসা। সবচেয়ে একটা মানুষ যখন ট্রিটমেন্টের জন্য যায় তখন তার মূল জায়গাটা থাকে যে সে কাকে বিলিভ করতেছে, তার ভরসার জায়গাটা সে পাচ্ছে কিনা। এখন দেখা যায় অন্যান্য দেশে বা আমাদের দেশে বলেন যেই ভরসাটা তারা চায় হয়তোবা সেটা তারা 100% পাচ্ছে না। থাইল্যান্ডে যেটা হয়, যখনই তারা যায় ডক্টররা তাদেরকে এত সুন্দর এক্সপ্লেইন করে যে তার কি সমস্যা, এই সমস্যাটা কেন হইলো, প্রত্যেকটা যখন ধরে ধরে ডক্টররা তাকে বুঝাই দেয় তখন কিন্তু তার ভরসার জায়গাটা তৈরি হয় এবং সে বুঝতে পারে তার প্রবলেমটা কেন হইলো, এই প্রবলেমটা আসলে আমার সলিউশনটা কি। এমন না যে আমার একটাই সলিউশন, ডক্টররা তাদেরকে এক্সপ্লেইন করে যে প্রথমে তুমি এটা করবা, এটা না হলে আমরা এটা করব। তো টোটাল একটা প্ল্যান তারা বুঝে যায় যখনই ডক্টরের সাথে কথা বলে। তারা না বুঝলেও আমাদের যে ইন্টারপ্রেটাররা থাকে তারা তাদেরকে সুন্দর করে বুঝাই দেয়। তো যেটা হয় তারা ওই ভরসার জায়গাটা তাদের তৈরি হয়। আমাদের ধরেন শুধু ডক্টর কিন্তু না, প্রত্যেকটা ট্রিটমেন্টে আমি মনে করি যে ডক্টর ইজ নট অনলি ওয়ান পার্ট। ওখানে নার্সিং এর একটা ব্যাপার আছে, ওখানে আদার সার্ভিসের একটা ব্যাপার আছে। নার্সরা যত সুন্দর করে ওদেরকে বুঝাই দিচ্ছে যে ওদের পরবর্তী স্টেপ ওদের কি হওয়া উচিত, ওরা কিভাবে থাকবে। আর আমাদের যে সাপোর্ট টিম আছে ওখানে হসপিটালে, তারা ধরেন তারা কিভাবে থাকলো, থাইল্যান্ডের মতো একটা দেশে হঠাৎ করে গেছে, তাদের একটা কমফোর্ট জোনের একটা ব্যাপার আছে যে আমি কোথায় খাবো, কোথায় থাকবো, এই সাপোর্ট গুলো, কোথায় বেড়াবো, ইভেন কোথায় শপিং করবো, এই সাপোর্ট গুলো কিন্তু আমাদের টিম দেখা যায় যে ওরা 24 আওয়ার্স ওরা যোগাযোগ করতে পারছে। কমফোর্ট জোনটাই ওদের অনেক বেড়ে যায়।
রাইট। সো coming back to Professor, so what is remarkable about Vejthani Hospital is on orthopedics department. They are definitely they're known for other services as well, but particularly when it comes to orthopedics, they are extremely well renowned. Why is that?
It's from two parts. First is from the hospital side. The hospital, they give full support to, because you know that about orthopedics mostly is based on surgeries, and the surgery is based on also like related with technologies, and the technologies for medicals is absolutely high cost. But the hospital, they give fully support. So anything that new and helpful, anything that will give some benefits for the treatment, they invest on it. So first is the hospital, and second is when you talk about surgeries, it's like skills of the doctors also. So we got a good team for the well trained and good skills doctors. So that's why like combine these two together, the result of the treatment would be great. So when we treat someone and the treatment went well, they recover very well. So that's why we become more and more famous about the orthopedic side.
As one of the most renowned spine surgeons in Thailand and in Vejthani, so what are the type of conditions that you mostly consult with?
For me, mostly right now, because actually there's like different kind of disease for each patient's age groups. Yeah, because if you talk for young patients like children, mostly they come with deformities problems like curves of the spine. For the working age, they come with work-related problems like disc herniations or some pain on the spine. And elderly, it's degenerative problems, old people problems. So we can say like not exactly common problems they come to see us, but it's normally based on what age range of the patients.
What is the usual diagnostic process like? Diagnosis process like?
Diagnosis is starting from the physical therapy. It's from the physical examinations. So from the physical examination, we get some clues. So after that, we know that, okay, these patients, what we want to see further, it's like X-ray, MRI, or even nerve test, because sometimes the symptom is not very straightforward. So we need something to help us. So about MRI, nerve studies, these two, it also need like some kind of technology, as we say, because MRI machines, as you can compare, if you can see the MRI in the old days, the image is not very clear. But right now we have like new MRI machine, which is give us some like 4D image or something like that. And also like some patients who got some implant inside the body. Sometimes when we do MRI, when we do CT scan, it's blurred because of the metals inside. So the new machines, it can like subtract that. So it's make everything easier to get clear.
So many patients have a sort of, I would say, surgery phobia. Whenever they have an orthopedic condition, sometimes they're afraid that if I go to a surgeon, they'll always put me into the surgery. So in Vejthani, I heard that you guys also approach it sometimes appropriately in a non-surgical approach. So can you tell us a bit about that?
Yeah. First of all, actually, yeah, as you told, like I found in many patients, even in like my families too. Like when we planning to go to the hospital or to see some doctors, like my grandma, she told like, oh, I'm not going there because they will put me in operating rooms or something. So, but normally, not all the cases need to do operations, right? So we can say like only 20 to 30% of the patients who need operations. But first thing, we should be straight to the patients. Like if the patients not need to do operation, so we should not talk about it to them. But about conservative treatment, like treatment without operation, what we have now, we got physical therapies, which is important. Like when anyone, mostly it can solve spine problems with the physical therapies. And another, we also have some kind of pain management, which is like some facet injections, some injection to the spine, some radio frequency, which is can help about to relieving the pain without operations. So all this can help the patients.
If we talk a bit about expense, because when Bangladeshis sometimes they feel that it's better to go abroad because they feel it's more reliable or the case is too complex or this, why they don't want to do it in Bangladesh. But at the same time, expense becomes a big issue. Compared to the standard of healthcare in Vejthani, can you explain us a bit about how expensive it is and to enlighten the people or the audience who might consider in future if they deem appropriate?
Actually, it's not, the word expensive is very vague because first of all, as our hospital, as doctor was explaining, we are known as King of Bone. So basically we use the best implants, the best technologies, whatever. But the price, it's affordable. It's very much affordable because we try to adapt to the patient. As I was saying, that our hospital is not only based on like healthcare, like other hospitals where it's just about, you know, the money and that's it. Our hospital is like a family. So we have this bond with patients. Especially lately, we've been noticing it with the Bangladeshi patients. We have quite a good bond, like a family like this. So we try to help for the price in order to make it affordable for that patient. And actually, the cost is not that high as people expect because people expect that if you go to a private hospital, it's going to be like as costly as America maybe or UK or anywhere else. But it's not because it's still Asia and the cost is very, very good and affordable for people. And the second thing is there are different options. So people have an option to choose. Like, for example, for surgeries, you can do like minimally invasive surgeries with all the technologies that you want. But because of the skill of the doctor, you can also do with lesser technologies. So it's up to you. The technologies, they help in order to, you know, to improve the accuracy and other things which the doctor might be able to explain better. But at the same time, the doctor has enough skills to do it without some of those technologies that are needed. And also, I think because of the family concept, so we really do try to micromanage everything, especially the pricing details. So I personally, I haven't had any patients and I've been working 15 years. And I have patients from Bangladesh for the past like 13 years as we started the market. I haven't had anybody really complain about that it's too costly or something. Mostly it's just exactly what they can afford or what they're willing to pay, more to say, not really afford, what they're willing to pay for this service, this kind of surgery. So it's like money for value, but at a good cost.
Something that which is very interesting is recently in Bangladesh there was a big political event. So when the interim government came, the injured protesters, or in Bengali we say 𝗍𝗵𝗶𝗀. So among all the hospitals that they could have sent, they sent to Vejthani hospital. Why do you think they were so convinced that this is the right place to send our best of peoples?
I think, again, it goes back to the King of Bones and what we have established through our all these years that we've been doing. The reputation, the credibility and everything. And we are like also, people start to call us as the kingdom of orthopedics. So it's a whole concept of that. We've already set our name and we've been working so hard to make sure that every case is a success and that there's no problems to follow through everything. So I think they just feel confident. They know that if they send here, we can really help. And also on this trip, we actually managed to go visit some of the other people who got hurt and, you know, closely work together with the hospitals that those people are admitted in right now. In order to see what else we can do. So in Bangladesh, the medical is very good. Also, the doctors are very good. But Thailand has a touch of technology, innovation, and a kind of new experience that is perhaps a different way of treatment. It might not be the best, but it might be. But it's a different way that it gives opportunity to those that could not be treated here. So that's what we did. We actually went yesterday. And we saw almost like, I don't know, 70, 80 patients yesterday, and some of them we chose that we can actually improve their condition and bring them to our hospital.
So recently, Vejthani Hospital's team decided to inaugurate a new office in Mohakhali. What was it about?
That was mostly because we want to give people a place that they can feel comfortable to submit all of their documents. And also it's like a middle point between the hospital and the patients here. Yeah, it's like a bridge. Because the office is able to help them with the visa, with the treatment plan. And the office, basically what they do is like, they're like a mini Vejthani here to help the patient process everything. And, it's good because also the hospital, we have a really, the office, we have a good relationship with them. So we directly organize everything. So if they want like a patient consultation, we can arrange that by video call, like telemedicine. Or if they need the patient to refill the medicine, we will help the patient to order it there and send it over here if they need help with visa, anything. Or if they have questions to follow up, like they came back, they did surgery, and then they came back after 2 weeks, they want to follow up, right? 1 month, 3 months, like this. So we let the office to follow up. And so the patient always, it's like from the moment they come there to the moment they come back, they don't feel like they're left out. Like for many other places where they just go for treatment and they come back, they have no touch point. They have nobody to help them. And what if I still have pain in 3 months? Or what if I need something else? What if I want, my grandma to consult, but how do I go back? I can't contact the hospital. So that is the middle point.
So, Professor, Vejthani is known for diagnosing a lot of rare diseases which were undiagnosed in other hospitals. Can you enlighten a bit more about that?
About the diagnosis, first, you should aware for something. Like when the patients came with some symptoms, if you're not aware about something, you never try to find it out, right? So about the first thing that helped doctor a lot is like the patients themselves also, because sometimes if they're not very clear about their symptoms, we cannot help much, right? So it's starting with the patients and then about the doctors and also about the teams of the doctors, because sometimes the patients come to one department, but the disease that really like main disease may be from another part, which is if the doctors, some doctors, they're aware about it, and if they have a team to send the patient to, it also helps. And the last thing would be the technologies that help to find that problems out. Because sometimes if we know that, okay, the patients possibly have this disease, possibly have these problems, but if we don't have the test to do, if we don't have the machines to scan the patients, so we cannot get a diagnosis. So it's all together, patients, doctors, and technologies.
So in all the surgeries that you do, if you want to have an idea about the success rate, what would that look like?
The success rate of surgery, actually, if the success rate of surgery is depend on like some factors. First is the patient's factors, because the health of the patient also affect. Second is the skills of the surgeons and the teams also, because when we do surgery, we not do it alone. We have the team, the whole team, not only doctors too, about the nurse, about the staff in the operating rooms to make it smooth. And the final thing is the technologies that we have, because if we are skilled, the team is good, the patient's health is fine, but if we cannot have a full technologies that we could have, so the success rate depends. So we can say in Vejthani, in our department about spine surgery, we can range the success rate like from 90% above if the patient is fit.
Among the Bangladeshi population, why is Vejthani so popular?
I think that's very popular because we've been taking care of a lot of patients, and these patients, they have word of mouth. So when they come back, they're happy. And then also because our success rate is very good. So the patients, they feel comfortable, like it's value for money, like I was saying before. And basically when they come back, they tell their friends and family, because here they have a lot of family members and everything, right? And then they consult a lot back to us through the office, and we can help a lot. So I think that it built a name by itself with just from word of mouth and from the service and taking care and the doctor's specialty. And also our doctors, they bond with the patient. So I think like with Dr. Pattara, he's always so bondy with the patient, like a family. So even they come back, they always ask him like, doctor, do you remember me? And he's like, yeah. And he remembers back like 5 years. Oh yeah, I did this operation for you. And then, oh, how's your mother? How's your father? And immediately it creates that bond where the patients know that they're valued. So you're not just a statistic that came to us like another patient. You're like somebody that we will look after, we will take care of. And then it creates that bond, like a different kind of emotional bond.
I'll go back to that finance question because this is so important among Bangladeshis when they're thinking about treatment. One of the notions they have is that Vejthani is very expensive in their mind. Can we get an idea compared to other Thai facilities and hospitals? What would be the expense range of Vejthani? Is it moderate, low, high, mid-range?
If you compare us to other private facilities, I would say we are about 20 to 30% lower with better value than those facilities, to be honest, as I was explaining. But if you compare it to, of course, government facilities, we're higher because we're private sector. But we are much cheaper, more value for money for private facilities. Especially you are getting the proper surgeon. For example, in other private facilities, what they like to do now is that they will just take a normal orthopedic surgeon and they will let them do the spine surgery, or else but that doctor may not have yet studied on that specific topic. But for us, we really make sure that our doctors are according to specialty. So they have all the right certification. They would have had significant experience in order to make sure that exactly the spine doctor is doing the spine operation. It's not just the general orthopedics doctor who's doing it, which is what makes value for money so important in this case.
Although majority of the people who visit Thailand have a great experience, but some do face difficulties to find the right hospital and all. What do you guys see that what are the common struggles that they face or some of them face in Thailand when they're trying to find the right health partner?
In general, I think it's people approaching they're trying to find just according to the degree. This is what I want to talk about because I think most people believe that the older the doctor, the better. Okay. I know this is a very international concept also. Okay. If the doctor is 70 years old, so that must be the best surgeon in Thailand. That has long changed now, especially in Thailand. Your doctor to seek in any specialist is between the age of 40 and 50 or 55, whatever like this. Because those doctors, they already caught up with all the innovation. So they know which technology to use. So for example, they can use the robotic technology, or like in spine, they can use it's called neuromonitoring to make sure the accuracy of the operation is, not touching the nerves, or the accuracy of the operation is 99%. So they know how to use that technology, and they're also very good at the surgery aspect. So they can 1 + 1, makes 2 instead of the older doctors, which they know the surgery, but they are not advanced in technology. So they don't have that additional aspect of accuracy. So they will do the surgery, but it will still be 95%. But with the doctor who's 40 to 55 right now, you will get 99%, but people skip that concept. So they usually find the perhaps wrong doctor according to their personal opinions and values, right? But instead, they should let the professional who's recommending them, in our case, this would be our office here, to help to choose the doctor according to their problem. Because we know, as people working there, as they are also people working with us, we know what is the best doctor. We know what is the best doctor for each procedure. Perhaps it might not be this spine surgeon for this procedure. It might be another one for another procedure. For example, scoliosis might be one doctor. Or for example, it could be 3 different procedures. This doctor is the best. So we will choose. The office will help to choose. So it's always better if you have a gateway to use that gateway and to try to let them help you at least. Yeah. And listen to why they are choosing the doctor. I think this is the main thing that I noticed.
Recently, you guys have done a couple of free sessions and programs. What was that about?
That was about, so we bring the doctor, like this time we brought Dr. Pattara to see the patients and to review their MRIs, everything, and to recommend what the treatment is. And then it really helps the patient because they really value the second opinion, I would say. It's always great to have two opinions. Like what I see with patients is that they really like their doctor here. And they just want a second opinion to merge together because the doctors here are really good. Like we would say that your doctors here are very, very qualified. And the patients are very happy with their doctor. And they just want a second opinion just to know that, okay, together we can do like this. And then most of them, about, I would say 70% of them, after that, they go back to their doctor happily and continue treatment. And then some of them choose to come to us because perhaps they're traveling abroad already. And okay, why not have surgery? I have, like a 2-week holiday or whatever. And they also have, some of them are seeking the innovative technologies, which are not available here. As I said, the robotic, the neuro monitoring, that's it. They have the skillful doctor. They don't have the technologies to support. So maybe from the 95%, they want the 99% accuracy, something like that. So we do these free consultations to give people an opportunity to get a second opinion, to learn more and to see that, okay, maybe what they're doing here is already the best in the world because every person wants the best, right? They want the best, but some
Especially
of them,
in healthcare.
Yeah. And perhaps maybe they cannot afford. So our consultations are open to everyone also. So we don't screen patients. Anybody can come and consult. So perhaps they're not even able to go abroad. They just want a second opinion. So that's fine. They come to consult. It's just a gateway between our hospital and here. That's it.
So বাংলাদেশে যারা এখন থাইল্যান্ডে যাচ্ছে গত 1-2 বছরে আপনারা যেহেতু একদম ফোরফ্রন্টে আছেন মেডিকেল ট্যুরিজমের, সেখানে আপনারা দেখেন কি কি সমস্যা নিয়ে বাংলাদেশিরা সাধারণত থাইল্যান্ডে যায় ওভারঅল?
আমার এক্সপিরিয়েন্স যেটা বলে, বাংলাদেশিদের সবচেয়ে যেটা বেশি সমস্যা আমি দেখি, ওদের কয়েকটা, যেমন অর্থোপেডিকের ক্ষেত্রে স্পাইন সমস্যাটা অনেক বেশি। এছাড়াও আমাদের জিআই পেশেন্ট অনেক বেশি দেখা যায়। আমাদের ফুড হ্যাবিট বা আমাদের লাইফস্টাইলের জন্য অনেক বাংলাদেশি আছে যারা গ্যাস্ট্রো সমস্যায় ভুগেন। তো এই পেশেন্ট আমি অনেক পাই। কার্ডিও পেশেন্ট আছে অনেক যারা স্ক্রিনিং এর জন্য যান। বিশেষ করে আমি যেটা পাই যে যারাই, থাইল্যান্ড কিন্তু একটা ট্রাভেল হাব, সবাই ঘুরতে পছন্দ করে এবং যারাই যায় দেখা যায় যে হেলথ স্ক্রিনিংটা ওরা থাইল্যান্ডে করতে পছন্দ করে। এই পেশেন্ট বেসটা ওখানে আছে। আর রিসেন্টলি আমি যেটা দেখতেছি, ক্যান্সার পেশেন্ট অনেক। আই ডোন্ট নো ওয়াই, আমি লাস্ট 1 or 2 years আমার এক্সপিরিয়েন্স বলে আমি রিসেন্টলি অনেক দেখতেছি যে ক্যান্সার পেশেন্টরা ট্রাভেল করতেছে এবং বিভিন্ন ক্যান্সার, লিভার ক্যান্সার, ব্রেস্ট ক্যান্সার, ইভেন সাম ব্লাড ক্যান্সার লাইক লিম্ফোমা, এই ধরনের পেশেন্ট আমরা রিসেন্টলি অনেক পাচ্ছি। ওভারঅল এই পেশেন্টগুলোই আমার মনে হচ্ছে এখন বেশি ট্রাভেল করতেছে এই ধরনের প্রবলেম নিয়ে।
এমনিতে বাংলাদেশিরা আপনাদের কাছে কখনো কমপ্লেন করছে যে লেটসে থাইল্যান্ডে গিয়ে ট্রিটমেন্ট নিতে গিয়ে আমাদের এই প্রবলেমটা হয়েছে বা ভোগান্তি হয়েছে যখন তারা নিজেরাই একটা ট্রিটমেন্ট নিতে গেছে? কারণ অনেকে হইতে পারে যে কেউ হয়তো ট্রিটমেন্ট নিতে গেছে, কোনো একটা ভোগান্তিতে পড়ছে, তারপরে হয়তো আপনাদের কাছে আসছে। এরকম কি কোনো, তারা কি ধরনের ভোগান্তিতে পড়ে যদি কেউ পড়ে?
এরকম আমার এক্সপিরিয়েন্সে এরকম 2-1টা কেস ছিল যে যারা এরকম নিজেরা গিয়েছে, হয়তো ওইরকম এক্সপিরিয়েন্স নেই বা কারোর থেকে শুনে গিয়েছে যে একটু কস্ট বা অন্যদিকে চিন্তা করে ছোট ক্লিনিক বা এরকম জায়গায় গিয়েছে যে আসলে ওদের ওই ফুল সাপোর্টটা নাই যে একটা থাইল্যান্ডে যে দেশের বাইরে জিনিসগুলো অ্যাভেল করবে অনেক কিছু। লেটসে যে অনেক ট্রিটমেন্ট দেখা যায় লং টাইম হয়, তাদের ভিসা এক্সপায়ার হয়ে যায়, তখন এটা নিয়ে একটা সমস্যা ভুগে। অথবা ওদের ওই সাপোর্টটা নাই যে কোথায় থাকবে, কি করবে। সো এরকম 2-1জনের এক্সপিরিয়েন্স এরকমও কমপ্লেন এসছে আর কি। তো দেন আর কি ওইখান থেকেও অনেকে যোগাযোগ করেছে যে আমি তো এখানে এসে এরকম, সো এখন কি করতে পারি। আবার আসার পরও অনেকে বলে যে ভাই এরকম গিয়েছিলাম, আমার তো ট্রিটমেন্ট কমপ্লিট আমি করতে পারিনি, সো এখন আমি কি করতে পারি, কিভাবে। দেন আবার ওনারা গিয়েছে, ট্রিটমেন্ট করে আসছে, সো আলহামদুলিল্লাহ ভালো আছে।
So, Professor, coming back to you, is about in orthopedics, a big part is recovery and rehabilitation. Sometimes clients are worried that what will happen to my recovery and rehabilitation given the distance. Do I have to every time go there? How long is the process? And how to approach this given that my doctor is in Thailand?
Actually, about the physical therapies after operations, it's like at the really first period right after operations, for example, like 5 to 7 days after operation. Yeah, definitely I still recommend to do it in Thailand. But after that, if the patients have to travel back here, we can like work as a team with the medical facility here. We can make a full medical report, some kind of full recommendations in details about the details of the programs. So they can continue it in any center, even here in Bangladesh. And also we have like some kind of follow-ups calls. So we can keep calling to the patients and can asking them like how about the situation, how about everything. And also sometimes we also connected with the physical therapists here or doctors here because we feel like we work as a team. Yeah. So after when the patients coming back here, they still got a treatment here, which is it's a treatment that we expect them to have.
Our last question to you is: we talked a lot about surgery, treatment, expense, cure. What can be a few of your advices so that people don't fall into the diseases? How can they sort of live longer, healthier, especially from your as a surgeon? What can you give a few immediate action points that they can follow as a
my first recommendation is, as we know, about like 80% to 90% of the spine problems come to what we did in each day. Like if you always like sitting wrong, standing wrong, do wrong activities, it happens for sure. It will happen. And second is about your body itself. If you can take care of your health well, you always do exercise, keep your muscles strong. Even you getting older, this problem might not come. Yeah. So take care of your activities, keep your body strong. And another is when you're starting to have some abnormal feelings, just not ignoring it. Because sometimes we feel like, hey, got some back pain, maybe some normal pain. So just forget about it. Live with the pain. So it's maybe early signs of something. Yeah. So if you're starting to feel some abnormal things, so just see the doctors. Just discuss with the doctors. Maybe it's just like simple problems, but if sometimes it's leading to like an early sign of something huge, it maybe help you. Because when we found some problems like earlier, that's mean, okay, it will be easier to treat, easier to solve.
Before we end, can you give just one example of sitting wrong and sitting right?
Okay.
I'm very curious, and I'm sure audience is curious as well.
So actually, most of the patients ask me like, okay, how to sitting right, how to standing right. Very simple way is like your back should be straight. So if you sit with your back straight, that's right. Because sometimes we like leaning forward, sometimes we leaning backward too much. It's not a good posture. Another most common question also, most of the patients, they ask me like, which is the best pillows? Here is like a common question. So I cannot say like which pillow is the best because as you know, each person head shape is different. So the same concept, any pillows that you sleep onto it, your neck straight is good for you. So you should try to like laying down on it and let some people check about like how about the neck is straight or not straight. Yeah. So in each day, if you can keep your back straight and whenever you sit, standing, driving, it's good for your back. It's good for your spine.
Yeah. It's a great, we got some free consultation there. So thank you everyone for joining. It was nice having you. It was a different experience for me and my podcast audience as well. And I hope that another day we can talk about another something more important. So thank you.
Thank you.